Speaking of a very important topic in breast surgery, I'd like to ask you, doctor, to explain a little about what a capsulectomy is, why it happens, and how it is treated in surgery.
Okay, well, whenever you, as a patient, think about getting implants, your surgeon is obliged to inform you about the potential risks associated with the surgery. One of those risks is capsular contracture. Normally, a natural tissue capsule forms around the implant once it has been placed inside your body. It forms in everyone, but in a certain percentage, that tissue becomes very thick. It's a tissue made of fibroblasts, and so the patient might over time have her breast become firm, feel hard, one side might ride up more than the other, or it might become painful. And that's when one might say, she has formed a capsule. The surgeon is indeed obligated to inform every patient that the likelihood of developing a capsule is approximately 8 to 14%, somewhere in that vicinity. Of all patients operated on, this is the percentage that could develop a capsule, whether they care for themselves or not. A capsule could potentially manifest itself 6 months or even 8 years subsequent to the surgery.
Oh, really?
Yes, and it may or may not require surgery. That also depends on the grade of the capsule.
And could this also potentially happen during the actual recovery phase, perhaps just a few days after the procedure, or is that not a possibility?
It's rarer, as it's confused with inflammation to assess it within those first few days. It is true that patients who have suffered, for example, a hematoma or have had a seroma or fluid accumulation or an infection are more likely to develop a capsule in the future.
Oh, okay. During the recovery process.
Yes, during recovery. If she had a hematoma, she's more likely to develop a capsule, right?
That's so important then, because that gives them a sign or a tip that this could happen to me.
This could happen.
Later on, during recovery.
Luckily, most patients avoid this, but it is a risk.
Yes, but it can happen. Thank you very much, doctor, for the information and for your time.
My pleasure.